From Rectangle Health, this is the Modern Practice Podcast. Every episode, we tackle a timely topic to help you stay current and simplify the business side of healthcare. Without further ado.
Hello, everybody, and welcome back to the Modern Practice Podcast presented by Rectangle Health. We've got a great episode in store for you today as we welcome Karen Marshall of Vero Consulting, a Rectangle Health partner, to the show. I'm excited to chat with Karen today. She brings over 40 years of insight and expertise in the dental industry to the conversation. In those 40 years, Karen has worked both on the clinical and business side of dental care. She holds a degree as a registered dental hygienist from Shawnee State University, has worked as a hygienist, administrative and corporate manager, project manager, trainer, dental collections agency partner, corporate consultant, and now advises dental practices on how they can increase revenue and run more efficiently. Karen will be joining us for a two-part series to talk about a range of topics around dental practice operations, starting today with HIPAA and OSHA compliance management. Karen, thanks so much for taking the time and welcome to the show.
Thanks for having me.
Pleasure's all mine. And before we get into the heavy-hitting questions, I know I gave an intro a second ago there, but I want to give our audience an opportunity to hear from you, a 40-year veteran. Can you tell us a little bit more about your experience and background?
Well, I started as a dental hygienist, and I had a wonderful mentor early in my 20s. And he said, you're going to be a good hygienist, and but he said, you have a business mind as well. So he set me off on a good path. I was a recipient of consultancy as a hygienist, and I knew that that's what I wanted to do at some point in my life, but you have to have some mileage behind you. So throughout the years, I took a lot of opportunities, trained hygienists, software implementation, integration, managed practices, flipped a couple of underproducing practices, and, decided it was ready to jump. And I was a national consultant for a few years before starting my business, consulting business 14 years ago. So that's the short story.
I'd say wearing many hats is the understatement of the century for you. Well, again, I'm excited to get into this. And as I mentioned earlier, for the first part of this series, we're going to focus on HIPAA and OSHA compliance. These are key areas that a dental practice always needs to be mindful of and remain on top of. Do you find that most dental practices are keeping up with compliance? And if not, why?
No.
Okay.
No. A lot of it has to do with just the understanding of each of these areas and finding the time to do it, and also the expertise, because these areas change. It's not static. Just like with HR, employment law, there are variations and changes often, and it's very difficult for practices or staff members to really be on top of it and be educated.
Yeah. I mean, we hear it all the time on this show. We see it on social media. We know how practices are short-staffed. The existing staff is facing burnout if they're not already burnt out. And obviously, patient care is priority number one. But again, compliance is mandatory and it must be maintained to avoid risks to the business. And I'd assume, as with any priority in any position, it starts with training. What should that process look like for new staff members and even legacy employees at a practice?
Sure. For legacy employees, there needs to be annual training for both OSHA and HIPAA, mandatory. Now, what typically doesn't happen is when a new hire comes in, they should be trained within the first 10 days of employment. What doesn't happen is exactly that, because most offices just schedule annual training. We do it in June. But you may have an employee that has already been there 6 months and doesn't have that documentation that they were trained. And oftentimes there isn't a venue for them to easily be trained. without bringing someone in the practice.
That's great insight. And that can be tough. I mean, going 6-7 months as a new employee with no training, and then, who knows what could happen there. And do you find that practices are typically better with HIPAA or OSHA compliance, one over the other?
I would say OSHA compliance, it's a little more streamlined. You can find the forms, the documentation, checklists for that. HIPAA is a little more gray. There are a lot of ins and outs that most practices just don't take the time to understand or comply with.
It's obviously very extensive. The law, the regulations goes on and on and on. And it's very hard to expect somebody to read every single page of that and understand it. But I do think, as you mentioned, within that first 10 days, if they get that core training, it sets up the practice for success. So part B of that first question was, I just want to get to is, what are the implications if they are weak in one or the other area?
Well, of course, there are hefty fines that come along with it, particularly with HIPAA. It's not just protecting the patient's privacy in the office. It's also how you are storing that information, protecting that information to protect a breach. We all know that there are breaches happening all over the place, but we have to document, record, track how we're trying to protect patients' personal health information.
Thanks for that, Karen. What does it take to trigger a HIPAA or an OSHA investigation, and how quickly could a practice find itself in, any sort of jeopardy?
It can just take one phone call. From a patient, a disgruntled former employee, to call the dental board or another agency. And when that happens, it can happen very fast.
Yeah. I always say it anytime when I speak about HIPAA or OSHA compliance on this show, we're not here to scare you, we're here to prepare you. So, what should a practice expect during a HIPAA or an OSHA investigation?
Typically what happens is it's not just, one patient file, let's say. If there's a patient that says, hey, there was a breach with my personal information, they open it all up. They're investigating all of the breaches, all of your documentation, what systems you have in place to keep that information locked down. Similarly, with OSHA, it goes back to your reporting, your documentation. They just open up the books. And then the fines start adding up, and they're hefty.
Yeah, and if something is discovered during those investigations, whether it be HIPAA or OSHA, what are the most common violations or penalties that you've seen throughout your career?
I think with OSHA, a lot of the things just come down to simple reporting, posting, those kinds of things that should just be following the checklist. Again, keeping your employees safe. With HIPAA, the most that happens, again, is sharing information from one person to another person, whether it be, a family member to another family member that isn't approved to understand that, like a stepmom, something like that she shouldn't have that information, as well as other entities that don't have a business agreement, sign business agreement with your practice, and you're sharing this information. So all of those ducks need to be in a row in order to try to be as compliant as you can and still our obligation is to safeguard our patients' information. And then again, with OSHA, safety in the practice.
Yeah, absolutely. And I think that's a perfect segue into managing all of this. As I mentioned in the top of the show, Vero 3 Consulting is partnered with Rectangle Health, so you've seen firsthand the power of bridge compliance firsthand. What are your thoughts on the platform, and how do you feel managing compliance through this tool? Does the tool take the burden off the practice and the staff?
It absolutely does. It's always, these two areas are always a challenge in a practice. They just are. And to stay up to date and compliant, the bridge is simple. It's easy. If you have a change in staff, the training is right there. Anytime you want to train a new employee or someone to take over and manage these areas, it's right there, hands-on. The bridge takes probably 90% of that burden off of the practice. And to me, I can't punch a hole in it. So it's great.
Yeah, and as you mentioned, 90% of the workload coming off the staff addresses some of that staffing shortage, the burnout, the issues with employee retention too. It's helping out when you have a tool to automate and do this for you and have that peace of mind. And I just want to thank you, Karen. I think this is a good place for us to stop now. Ahead of part 2 of this series, where we'll talk about the state of the dental industry as a whole. But before we wrap up, what's the best way for our audience to connect with you if they'd like to discuss revenue and operational efficiency at their dental practice?
Sure. You can contact me on my website, vero3consulting.com, or you can email me at info@vero3consulting.com.
Perfect. I'll be sure to include those links in this episode's description. And thank you once again for taking the time to join me. I'm looking forward to our next chat.
Thank you. My pleasure.
Likewise. For our audience tuning in today, be sure to like and subscribe to the Modern Practice Podcast on your favorite streaming channel, and be on the lookout for part 2 of this series with Karen Marshall coming soon. Thanks for tuning in. Till next time, everybody.
Thank you for listening to the Modern Practice Podcast. If you enjoyed today's conversation, subscribe on Apple Podcasts, Google Play, Spotify, or SoundCloud for new episodes. And follow Rectangle Health on social media for more helpful information, news, and event details. Thanks for tuning in.